Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond welcomes back Carrie Althoff and Elizabeth Stewart of the Johns Hopkins Bloomberg School of Public Health. They talk about how to approach our third COVID summer and what to do as we see rampant increases in cases and continued disruptions in our communities. Let's listen.
Carrie Althoff and Elizabeth Stewart, thanks so much for joining me.
Thanks for having us, Stephanie.
Great to be here.
So let me start with you, Carrie. Here we are. It's not long after Memorial Day, and I read somewhere 5 times more cases this Memorial Day than last. And I guess I'm wondering, have people given up on protecting themselves from COVID?
Well, I think we have to be a little more nuanced in the question. What are we trying to protect ourselves from? So are we trying to protect ourselves from infection? I think the answer that most people are resigned to now is no, we're not actually trying to prevent that, just the way we typically don't prevent an infection with a SARS virus that causes a common cold. But one thing that we are a little bit more concerned about is looking at our ability to protect ourselves against hospitalizations and death. And, we know how to do that. We've gotten really good data on these vaccines and how effective they are at keeping people out of the hospital or far worse. And I think the other thing we're continuing to focus on is how we protect our most vulnerable, right? So individuals that don't yet have access to the vaccine are those 5 and under. As well as older adults and people who may be immune compromised, who may not mount the response to the vaccine or may still be at high risk for hospitalization and death, even post-vaccination. So for the majority of the people, I would say at this point, trying to prevent hospitalization and death is the goal. And most people are now understanding and seeing the impact of these vaccines turning SARS-CoV-2 into something that we know was very serious in the beginning, and now it's turning it into a common cold for so many people.
Mm-hmm. And also, we don't really know how many cases we have in the community, right, Liz? I mean, I understand that the numbers are way off base.
Yes, I think, a good thing is that we have more access to rapid antigen tests, and people are often testing themselves at home and identifying cases that way. And sometimes those might get reported, sometimes they don't. People might have such a mild case that they don't ever end up testing, and they might never even know that they are positive. So we know that the rates are severely underestimated in terms of the official case rates. I think estimates now are that it could be even 10 times as many cases actually being around. I think the other point too is that, whether people are sort of making decisions rationally or sort of deciding, oh, I'm just giving up, I think there's still a lot of misinformation. So, the testing rates are hard to establish because of these issues I just mentioned, but also there still seems to be just a lot of misunderstandings about the disease itself. People still don't fully understand, I think, the benefits of vaccination in terms of reducing severe disease and death. And I think people still also don't fully recognize the airborne transmission nature of COVID-19. I have been on quite a few flights in the past few weeks, and many people on the plane would get the little wipe from the flight attendants and would wipe down their area, sort of clean their surface, but they would not have a mask on, and sort of need to recognize that really the risk is probably from an airborne transmission and not wearing a mask, and not the surface transmission. Because of that, I hope that we'll continue to have conversations about the benefits of ventilation and masking, and sort of help people really understand how they can reduce risk.
Mm-hmm. Sorry, we're also obviously seeing a lot of disruptions right now. I mean, I know COVID swept through your house.
Yes, it did.
And Liz's as well. It's just as disruptive as it's been since at the beginning.
That's very true. And I think, in our situation, sadly, we didn't have the clearest policies set forth from our school. And so we really had to push on that. And thankfully now they've cleaned those up. And I know many parents have been in a similar situation where once it happens to your household and you're wading through all this, you're thinking, wait a minute, what is happening here? We need to align with the science. Let's figure this out. And it's a lot to put on a family that has a bunch of kids all of a sudden back in the household. And so, the disruption that it creates is still very, very real in so many people's lives. And we can't forget that, we know the value of kids being face-to-face in school and in a safe environment. And so we have to always think about how to best protect that, how to keep our kids safely in school and maximize their in-person learning days now that schools have resumed. With safety at the forefront and including structural interventions, as Liz said, about ventilation and different ways of doing things to reduce transmission. But because, it's still so disruptive, I hear a lot of families saying after it blows through their household, oh, that was it, right? Because they're vaccinated and it did turn the disease into something that was mild and manageable at home. And then it was a waiting game, to finish out their isolation. And I think what we're seeing now with a continued decoupling of the case and the transmission rate with the hospitalizations and the deaths, that is very good news for us, for every community that's seeing this, because what it's essentially telling us is that we're building up high enough population immunity that we are able to prevent hospitalizations and deaths. And I think we just have to remember that is our orientation with this, right? We want to keep people out of the hospital. We want to keep people alive during this COVID disease process. And so using all the tools, if we continue to see this decoupling, I think families have to get ready to pivot again, and hopefully pivoting into, the next steps of our new reality and what that might look like. But, we have to recognize that there are countries in the world with high vaccination rates that have really backed off isolation and quarantine recommendations. We don't know the timing of when that may or may not happen in this country. And of course, that is all going to be at the mercy of whether or not perhaps a new variant that causes illness, more severe illness, even in those who are vaccinated, if something like that emerges, all bets are off. But I think families, as we prepare for this summer and we get ready for, a change from the school year normal, and we are looking to be outside and looking to have those experiences with our families, be ready to kind of think broadly and perhaps hopefully, pivot again this fall with changes in recommendations that may be forthcoming.
Liz, I was going to ask you sort of how we should approach summer from a COVID perspective.
I think much of what we've been doing the past couple of years continues, sort of get vaccinated and boosted if you haven't already. Try to do things outdoors. The beauty of summer is that we can do many things that help make it safe, and it's not a burden. In fact, it's a joy to be outside, at least in some parts of the country in the summer. So I think sticking with sort of those fundamentals, but people who are vaccinated, might feel more comfortable going to indoor events, weddings and family reunions. We, in fact, just had our own first time seeing the grandparents in a couple of years. And it was wonderful. And so I think taking advantage of that time as well will be really important. The other thing I would note, though, sort of to the disruption point from Carrie, it's certainly true. And I know both my husband and I stayed positive on those daily rapid tests for about 10 or 12 days. And we were isolating from our kids, who luckily handled things very, very well. But I would encourage families to sort of think through what their plan will be if someone gets sick, whether it's a kid or an adult in the household, what they might miss, the pivots that they might make, and stock up on those daily rapid antigen tests, because we went through quite a lot, making sure that every morning before the kids went to school, they were still negative, and things like that. So just think ahead a little bit so that then if it happens, which it might, you can be prepared and not feel fully overwhelmed in the moment.
We have a graduation coming up that'll happen before this episode even airs. And I know that there are people who are now like afraid to test. Is that going to be an issue?
It's definitely an issue. I think there's a lot of fear to test because that positive result does have implications, right? That means, you should be observing isolation. It has implications for your household. But I think the thing we have to remember when we test, even when we're kind of trying not to see the result, we have to remember that if you are positive, you have a responsibility to stop the transmission to others. And that is a very real responsibility. And some people will not take that seriously. I recognize that. But I think a lot of people do take that seriously because the people most likely to be infected from you are the people closest to you. So particularly before a family reunion or a wedding or a graduation, to know your status so you don't end up causing infection to others. And we know how this plays out, right? We hear afterwards, 10 people who went to this party are now sick, right? And part of us at this point, we're kind of like, yeah, we didn't have masks and there wasn't testing or it wasn't encouraged. Like, we know these things can happen and we know how to prevent those things. And yes, it will mean disappointment. I know my children missed their field day at school. So there's disappointment that comes with it. I'm not denying that, but taking that responsibility to make sure that you are not further infecting others, particularly those that you love, people that you care about. It is really important. And I think people do remember that. As a side note for those rapid tests, one of my favorite resources now are public libraries. So check out your public library, ask for one. If they have them, they will likely hand it out to you. It's about 1 box per person. There are usually 2 tests in the box. So make sure that when you go in there with your kids for summer reading or whatever you're in the library for, ask for one, because if you're like my family, we were legit having Amazon deliver an obscene number of tests every other day in order to, just as Liz said, keep our status known, because we wanted to be sure that we were not positive when we came out of quarantine.
So Liz, this is going to be different than the last summer, right? I mean, things are definitely improving. And I guess I'm just wondering, I'm still nervous about getting it. I'm still nervous that it could give me long COVID, all of those kinds of things, but we shouldn't be feeling as fearful as we have in the past.
Yeah, I think vaccinated and boosted individuals should feel pretty confident. And I know, at least for ourselves, partly it's a question of disruption and sort of that, what is coming up and what do we not want to miss in the next few weeks, and sort of wanting to get through that. But the illness itself, for most people who are vaccinated and boosted, can be mild. It's going to still come down to individual and household risk tolerance. And just like we all make different decisions on how fast to drive or whether to go off that rope swing into the lake, personally, I've never been tempted by that. I think we'll see different levels of risk tolerance here too. And that's hard. People have to, sort of understand the context well enough to be able to make that risk assessment for themselves. And so that gets back to sort of what data is available, and really encourage people. Earlier we talked about how the case rates are not great. That said, they still are a useful metric. And in particular, monitoring kind of how quickly they're going up. If you start seeing rapid rises, that's when it might be a time to take a step back and maybe reduce the indoor activities. So again, there might be variation across time, and certainly there's going to be variation across households in what the risk tolerance they're willing, and thinking about the kind of cost benefit, risk benefit of an individual activity. But that's where rapid tests can help make those gatherings safe, outdoors, again, sort of many of the same core things that we've turned to throughout the pandemic.
I'll give you the last word, Carrie.
So Liz is spot on. And we have said this a couple of times in our previous conversations. Look at the changes in these indicators that we have come to rely on. And even though we know we're undercounting cases, if you see rapid rises in cases, something's going on in your community, right? Things are heating up a bit. And so if you're going to go visit a loved one who may be at higher risk for severe disease, layering up with the mask or reducing your exposures in other ways in preparation is the dance that we are going to continue to do throughout the summer. There are going to be times where, your kids are going to be running around at the pool, or you're going to be going out to dinner with the spouse and you're like, we're going to eat indoors. We're vaccinated. We're boosted. We recently had COVID, something like that. And so recognize that our risk tolerance, it is a household level situation, but it is changing over time as well. And so that's okay. And, I think we have to be confident in our decision-making because, families have been in this for 2 years. We still have families with kids under 5 who are still in that progression towards a vaccine. So families are still in very different places and trying to do what's best for our kids and our families. And so recognizing that we're versed in this decision-making, we're versed in these indicators and looking for change in the indicators, and then working with your family and your community to make sure we're protecting our most vulnerable is going to be the name of the game as we continue to build our population level immunity and live with SARS-CoV-2.
Carrie Althoff, Elizabeth Stewart, thank you both so much for joining me.
Have a good summer, Stephanie.
Yeah, enjoy the summer.
Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.